Hello, everybody, and welcome to today's Portugal Pathways webinar. I'm just going to invite your panelists for today just to switch their cameras on, and we will get underway. Wait for Paul and Paul. Hi, Paul. Hi, Paul. So, hello, everybody, and welcome to today's webinar on health and wealth in Portugal. My name is Steve Philp, and I'm the Partnership Director here at Portugal Pathways, and I'll be hosting today's discussion. We have a great panel joining us today to explore two crucial areas for life in Portugal: people's health and people's wealth. So, I mean, let's be honest, you can have all the money in the world, but without your health, it's not a lot of use to you. Today, we'll be exploring the different healthcare options available and the long-term wealth planning in Portugal for peace of mind and security. But firstly, please let me introduce our panelists. Firstly, we have Ines Santos Silva. She is the co-founder and CEO of Tijo Med, and she brings her expertise in innovative healthcare solutions tailored for international residents. Joining Ines today, we have Paul Stannard. Paul is the chairman and founder of Portugal Pathways and the Portugal Investment Owners Club, leading strategic initiatives for global investors and expats. Joining them, we've got Chris Marsden. Chris is CEO of RTI Family Office as an expert in wealth management and financial planning for international families. And finally, making up our panel today, we have Mr. Paul Sheedy. He is the special advisor to the Portugal Futures Fund, specialising in strategic investment opportunities in Portugal. Welcome, everybody, and obviously thank you for joining us today. So let's get started and we'll dive straight in. Ines, for people new to Portugal, can you sort of explain how the public and private healthcare system works, and obviously how they sort of complement each other as well?
Yeah, sure. And first of all, thank you very much for having me and to be part of this conversation. It's true that Portugal has a public and a private healthcare system, and a lot of people actually use both. So if you look at the public health system, or Serviço Nacional de Saúde, as it's called in Portuguese, is very affordable, often free, and provides solid healthcare, especially for emergencies and acute situations. So it's very looked after for those situations. It covers a wide range of services, including GP visits, specialist care, hospital treatment, maternity care, and emergency services, as I have said before. It also includes a nationwide network of hospitals and local health centers. And something that I think should be valuable is that the doctors, nurses, and medical professionals are very well trained. And so the quality of their education is very high. So we often visibly find very good doctors when we go to the public healthcare system. So this is the public healthcare system. In terms of the private healthcare system, we are talking about a system that has been actually growing a lot over the past few years. I think maybe 20 years ago, we had a few private hospitals, but now we actually have much more. We have much more options for anyone coming from abroad. And these services these private healthcare centers offer quicker access, flexibility. They are world-class in terms of facilities, so people actually have good access to good healthcare when they use them. Usually the private care typical offers shorter wait times, more choices, and also English-speaking doctors. So I think like more than 90% of the doctors in Portugal speak English at a good level. And the reality is like many people actually choose a combination of both. For a lot of times for emergency care, if there is an accident, if there's something that's like very, very, that requires a lot of like healthcare attention, that sometimes they use the public healthcare system. If they need something like faster, like for there's like something that there's a throat ache, or if they need to see a specialist, they go to the private healthcare system. So I would say, even me as a Portuguese person growing up here, I would say like I definitely use a combination of both, and this combination of both can be very helpful for you to manage your health needs and concerns.
Thank you, Inish. That was a great overview. Thank you. Paul, is there anything that you would like to add to that at this stage?
Yeah, I mean, I'd reiterate what's already been said. But, it is important to understand that combination of both private and public working together has created, a really good, efficient ecosystem. So if you have an acute problem, in the same way as you would in the UK, you go into the public health and it will deal with, whatever's in front of you. But the private healthcare market in Portugal, as more investment and money has come into the country, that has become much more sophisticated, and not just in the capital. It's now spreading across the country. And the other thing, I would make the point of, even very specialist things. We had a client last week who had a particular issue, condition that they had, which was quite rare. When we actually researched it in Portugal, there were 4 different places up and down the country that they could go to get continuity of healthcare. And in terms of healthcare infrastructure, I think Portugal is now 3rd in the world, which is, quite a compliment to Portugal in terms of the size of nation. What it puts, into its healthcare.
Well, thank you, Paul, and thank you, Nish. Chris, I'm sort of going to come to you on this one. Do sort of most individuals need sort of private health insurance here when coming from abroad? So how does it sort of work in practice?
Thanks for that, Stephen. Good afternoon to everyone. Thanks for coming along. I mean, in essence, if you're coming to Portugal on any kind of visa, you'll need private medical insurance. I mean, as both Inish and Paul have said, you can still use the public system, but clearly, the Portuguese government want to ensure that people coming here don't become a burden on the system, and so they insist on them having private insurance. And there are initiatives there where people like TJMed have got additional doctors' clinics, which allow the person moving to Portugal not to be a burden on the public sector. Although, again, that being said, if something serious does happen, then you do have the ability to be seen straight away.
Thanks, Chris. Just before we sort of move on to the next question, I just want to reassure everybody that today's obviously session is being recorded. So if for any reason you have to drop off early, a replay will be obviously sent to you within the next sort of 36 hours or so. And finally, obviously, we've got obviously covering a lot of subjects here and a lot of topics. If you've got any questions or any comments, please leave those in the chat. We've got a Q&A at the end, but if we don't get the chance to get to all of those questions today, our team will go in behind and answer those questions. Again, if you've got anything specific or personal to your own situation and you would like to organise a discovery call with any of the panelists today, please, again, just leave that in the chat and our team will organise that for you. So staying with you, Chris, I'd like to sort of touch on estate planning as well. From my understanding, Portugal does not have a gift or inheritance tax, which makes things very favourable for families not wanting to give all their legacy away to the government, as maybe the people in the UK are now experiencing. So again, is that actually I'll put that to Paul. Is that something you can quickly sort of touch on for me, Paul?
Well, in terms of sorry, could you throw it, Chris?
Yeah, sorry, Paul Sheedy. We've got 2 Pauls, haven't we? Paul S.
I can.
Yeah, sorry.
That, Steve. Yeah. No problem. Thanks, and hello to everybody that have joined us today. Glad to be on with you. So the inheritance tax and the gift tax is very favourable in Portugal, and I think that is a big factor for people who are thinking longer term of where they want to be, and particularly people who are thinking about moving to Portugal. Our fund is focused on golden visa application by investment residency, which is a program of you invest $500,000, which is the current figure. You invest it for 5 years. You spend no less than 7 days, but only 7 days if you want to, in the country over those 5 years. And then after that period of time, you can apply for dual citizenship. So that gives great options, and it is things like inheritance tax and the healthcare system in Portugal, and obviously the fact that the weather is pretty good and the people are lovely makes it a very positive environment for people to consider it. And in particular in healthcare, our fund actually has healthcare as one of our focus areas in Portugal for investment, because of what Inish and Paul Stannard has said already, is that there's an awful lot of expansion, first of all, of premium healthcare in the country, which is always a very good investment opportunity, because just by counting the number of people, you're pretty good at getting the offtake on what people will use the facilities for, and we mix that with other things. But we also think there's a lot of very good entrepreneurs in Portugal in this area, and people are drawn. Entrepreneurs from outside Portugal are drawn to Portugal because it's very good tax environment to be in as a startup company. So therefore, we've got talent coming into a growing market with innovation. So we see a lot of headroom in investment opportunities within Portugal.
Thank you, Paul. Another question with regards to sort of Portugal's economy and how that is having a positive effect on people's health and wealth in this country. Paul, I believe that you have a couple of slides that sort of illustrate what's going on as it relates to confidence in Portugal and where it's heading. So obviously, just to illustrate that, we'll get these slides out. If you give me 2 seconds, Paul, I'll just find those for you. So here we go. So here's the economic slide initially, and then we've got another one to bring in after that.
Yeah, so just talking to this slide initially. So, Portugal's in a good place. If you go back to the financial crisis, when Portugal would have been pretty low down the league table of economic powerhouses in Europe, along with Greece and some others, were being bailed out. What's happened due to the Golden Visa residency program, due to the NHR tax regime, and the fact that Portugal is a safe and welcoming environment, investor confidence in Portugal is at an all-time high. So Ernst & Young do a report annually on different international locations, and when it compared Portugal with many other locations, including Europe and the UK, investor confidence was at an all-time high at 84%, which is right high against anything internationally. And when you look at the overall GDP of Portugal, that's quite something from where it was 15 years ago. GDP is actually growing faster than the UK and the Eurozone. And also investment attractiveness in terms of people things improving over the next 3 years is significantly higher. And another stat, because I see the screen, these are a lot of UK stats, but in terms of the Eurozone and North America, inflation actually is decreasing. In fact, it was out yesterday. The inflation is last month went down to 1.9%. So this stat has last month's figures, but it was down to 1.9%. And that's seen against North America, the Eurozone and the UK, where they've seen increases in the last few months, although there was slight decline in the UK in March. Do you want to go to the next slide?
Yeah, maybe 2 seconds, Paul. I've just got to reload. And
while Steve's getting that, the other slides up, it's important to understand what's driving that, because obviously it's not every sector. There are some key sectors in Portugal that are, really important to that ecosystem in terms of that that growth that we're seeing, and health is one of them. Health tourism is massively expanding in Portugal. Health innovation, you've got organisations that are investing in R&D, institutions that are investing in major projects to do with neuroscience, cancer research, regenerative medicines, and also in terms of the private health insurance growth, because there's so much international wealth that's coming into Portugal for at least the next 4 or 5 years. The private health insurance market is, seeing 8% CAGR growth annually, and in terms of similar sort of numbers for home healthcare sector, and particularly interesting in terms of Tejo Medical, what they're offering in terms of their GP private solutions and access to doctors. This is becoming quite fashionable internationally. I know in America this is becoming very popular, and in other parts of Europe. And I think innovations like that are really going to help aid this sort of health infrastructure that's already now got strong roots. And the other thing about it is it's affordable healthcare in Portugal compared with a lot of the nations, particularly Americans, who spend more on healthcare than anyone else, but don't necessarily get the best bang for their buck in terms of what's going on. And I don't think maybe tariffs are going to be helping the Americans on that anytime soon. So healthcare is a really strong sector. It's one of the pillars. And the next one, Steve, if you could go to the next slide.
It should be up. Media and events.
Oh, media events, thank you. Yes, so Lisbon now is the 3rd most popular capital city in the world to hold international events. It already holds the Web Summit, which is Europe's biggest tech event, the global IFAs conference, so all the wealth advisors from around the world and international tax advisors will all be descending on Lisbon in October, looking at international tax and wealth structures. 2,500 delegates representing some of the wealthiest people in the world. Obviously, the news about the World Cup coming to Portugal is going to have an impact over the next, 5 years and probably 7 years, because post these major global events, there's usually another fillet that goes beyond that. And there's a lot of media talent coming into Portugal, and you're going to see that in terms of the economic outputs. If you look at the stats here, sports media, 4.2 billion up from 3.36 billion, so 25% increase, and then another billion on top of that because of the World Cup coming. In terms of infrastructure, upgrades to venues around the country and infrastructure is also going to be important to that. And the CAGR growth indicators for the next 5 years are very strong in that sector, and we only see that growing. And then the third sector is tech. Obviously, media and tech, correlate anyway, but because you've got 90,000 engineering graduates, second highest in Europe, and then you bring in that with other international talent that's coming to Portugal. Portugal last year introduced this new tax thing to encourage young talent, so people under 35. It's 0% tax for 5 years. There's also 11 billion was generated from the tech sector in the first quarter of 2025. And there's hubs not just in Lisbon, but also in Porto, Braga, and the Algarve. So it's not just all concentrated in one area. It's spreading around the country. The Nanotechnology Institute in Braga was launched by the government there over 15 years ago. And that has some phenomenal innovations in terms of deep tech, which affect over 16 different industry categories, and the startup scene grew by 16% in the last 12 months alone. And with a strong infrastructure and lots of investment coming in from the EU, because now Portugal is a net contributor rather than having to be bowed out. It's now, all of those combinations together are really driving Portugal's tech scene. And then next, Steve. And obviously you can't ignore tourism and hospitality. It's the #1 relocation destination in Europe now, and tourism, it's driving its standards, because demand, as more wealth comes to the country, it wants improved quality of hospitality and tourism, and so 10,000 new hotel rooms by 2029, and 8.7% year-on-year increase. Huge investments going into transport infrastructure, 14 billion investment plan for the new Lisbon airport. And obviously we talked about the World Cup and some of the major international events that also drive this noise around Portugal. And finally, the last sector I wanted to talk about in terms of driving the economy is actually renewables. In terms of the renewables market, 71% of all electricity is now generated from renewables, with the Europe only being just over 50% and the world being just over 20%. So again, clean energy, clean environment, sustainable revenue streams and income that are good for them and also good for our health and our wealth.
Thank you, Paul. And just to let the audience know that, obviously, as I said before, we will be sending out a link with a replay. So obviously, if you want to digest some of that detail in a little bit more, in a bit more time, you'll be able to do that, obviously, when you get the replay, and just about pause it and take some of those stats in. But very interesting and very encouraging. Inish, I'm going to come back to you. What are some of the most common frustrations expats experience with healthcare in Portugal, as it all can't be sort of rainbows and sunshines as maybe what we're saying today? What do you sort of personally see?
Yeah, no, exactly. I think like as I was said before, I think the healthcare system is good. It's international recognized. I think Paul mentioned that, and so it's international recognized. There has been a very strong commitment from the different governments to keep our health system as it is. It's, of course, it's not easy to provide universal access and universal care for everyone, but this is an effort that the country is doing. And so for anyone that comes here, they can expect high quality healthcare system, universal coverage, and in some key areas like infant mortality, vaccination rates, and life expectancy, we also rank very well. But that being said, of course, there are things that frustrate us, and that's one of the reasons why we started TejMed, because we really felt like, even though there was a lot of like the healthcare system was good, there were a few areas where we felt like there was a lack of response, and that's what we are trying to do. So I think like one of the things, no matter like, I think in the public healthcare system is more prevalent, but also and starting to even become worse in the private healthcare system is the waiting times, right? So it takes a while for you to be able to book a specialist, sometimes months. That actually is very much impacted by your private healthcare system, or sorry, by your private insurance, the insurance that you have. So in the private healthcare system, different insurances sometimes give you also different waiting times, and that's something for us for everyone to consider. That's one of the things. And then sometimes there's like a lot of like waiting times. Even recently, my co-founder Tyler was in a waiting room recently for a specialist, and it was like already an hour and a half in when he was actually be able to see that specialist, right? So waiting time is definitely a problem, and it can be a cause of a lot of frustration. And the second thing is rushed appointments. In Portugal, like everywhere around the world, I would say what we get now is 10 to 15-minute appointments. They feel very much transactional. People don't feel seen. And when our issues are around like a cough or something that is like worrying us but is like very limited in scope, I think 10, 15 minutes might be okay. I think the problem is when our health concerns require a little bit more attention. 10 or 15 minutes is definitely not enough. And I think that's area of like, for me, like a frustration, but for also a lot of the people that I end up like talking with is like the fact that it's very transactional, very rushed, and people don't see seen as a human, right? It's just like in and out with a prescription, and then that's a challenge. Another thing that also, and especially for me, I have to say this is like very important, is that care a lot of the time seems very fragmented. So you go from specialist to specialist, but you don't have anyone that actually has your back, that knows you and knows your health history a little bit more, like from a 360 view. And so what we are seeing is that a lot of the times people that come to us, and I personally felt this firsthand, is like, okay, even if I can access the specialist, I'm not a doctor for me to then integrate the information. I need a doctor that knows me, a doctor that can support me and can help me integrate this information. So I think fragmented care is another issue. And just to finalize, I think like, even though I think I think we do well with acute care, I don't think that we do well with preventive care. I think we are one of the worst countries in Europe in terms of like spend in preventive care. I don't think that we do well with mental health and lifestyle-oriented support. And these are areas where usually expats, people coming to Portugal, expect and value. And I think in those areas, we clearly don't do well. So again, even though I think like for acute situations, for emergency situations, I think the public and the private healthcare system do well. It's possible to book specialists in the private healthcare system directly. I do think there's a lot of frustration around booking times or waiting times, the fragment of care, the lack of prevention that a lot of people value, and they want a different approach to healthcare in those regards.
I would probably say that the majority of public healthcare systems are experiencing similar challenges, should I say, certainly obviously in the UK as we know. And Chris, I'm going to sort of come to you on this one. This is obviously about trust. So how can sort of trusts and family offices be sort of used to manage generational wealth in Portugal?
Well, that's an interesting question, Steve. I mean, every family is different. Every person's different. One of the things you have to be careful of is trusts don't work in Portugal. So you need to be aware that, you know, if you set up a trust, what you're doing it for is to pass money down generations, so that they can come out of the trust and then into a vehicle in Portugal that works. Most of the families that I've worked with who come to Portugal find other solutions rather than a trust that works for succession and generational wealth planning. Normally, life insurance-based solutions are the ones that work in Portugal. But equally, another option is if you're of the, if you have the right amount of wealth and everything works in the right way, setting up a family office will build long-term generational support. So, I mean, we could spend a whole webinar on family offices, I promise you. And, you know, it's all about educating and informing each generation as to how the money can pass down, one, without succession taxes and issues in Portugal, but also two, how to manage it in the best way for the long term. I think one of the issues that people look at as well is the golden visa options. People look at investing money to get the Portuguese residency and the Portuguese citizenship. We've seen that through some of our clients, but I think, you know, how they are used is basically to put together long-term tax-efficient vehicles that enable you to manage your money over 50, 100 years. And you know, there needs to be a certain amount of wealth to do that. But if you have that amount of wealth and you're looking to pass money down generations, there's certainly something you can look at. You can look at family offices, you can look at family companies, you can look at family LLPs, you can look at trusts, but all of these issues depend on where you're based, where your children are based, where your grandchildren are based. And the one thing you can't control is when you die. The one thing you can't control is when you die, but what you can control is the taxes you pay when that happens. And also, I think you can control the ability to get long-term care and long-term health from these private providers that we've been talking about. I also think the other thing is, moving to a country like Portugal with the climate, with the diet, with the lack of stress that should be going on. If you get all your affairs in order, you know what? You'll probably live longer just because you don't have as much stress in your life, and day to day you're enjoying what you do. And there is a reason people in Portugal seem to live for a relatively long time. So let's not forget what the effect of nature on your and the environment on your well-being and health.
300 days of sunshine will do that, Chris.
That's not too bad, is it?
That's not too bad at all. Thank you, Chris. Inish, I'm going to come back again to you. So your organisation sort of main focus, as I sort of understand it, is proactive and preventative care. Yes. So what does that mean in sort of real terms for your patients? And have you got any sort of examples that you can share with us in the audience today?
Yeah, sure, I can help share. But just going back to what Chris was saying, we do have people that come that are patients of Tejumed that mention that they moved to Portugal just for the sun and for the food, because people that are looking for a healthier, a lot of people that are focused on longevity, they do move here because of that, especially Lisbon and south of Lisbon, that offers really a lot of high quality lifestyle that is very conducive to living longer and living better. Going back to Tejumed and the way we do, it's true that we focus on proactive and preventive care, and we do that through a membership-based family medicine model. So our model allows us, our doctors, to see less patients. Because they see less patients, they are able to spend more time with these patients, addressing what I was mentioning before of the rushed appointments, the fact that people are tired of feeling that the appointments are very transactional. So our doctors have more time, they spend more time with their patients, and they even have time to research on behalf of their patients if needed, if there is a specific condition that requires that research. Each patient is also paired with one unique or dedicated family doctor. And this is something where we are different. In here, we are not going from doctor to doctor, where you always have to explain who you are, what you have been through, your health concerns and goals. You do have a doctor that knows you, and gets to know you with a 90-minute onboarding appointment that really focus on getting to know you, understand your concerns, your goals, your family, or your health history. And then from then on, there is a long-term relationship that we developed that is preventive. So we understand the baselines, we understand what people want to accomplish with their health, if there are specific chronic conditions that they want to address, and then we try to do a mix of medical but also lifestyle approaches that focus on nutrition, exercise, sleep management, stress management, and so on. That really helps them to have more health. In terms of specific situations that we try to track, for example, with our patients, we try to, as I was mentioning, understand the baseline, and then from that track blood markers and other biomarkers long term. So if there is a specific, if anything is changing, we can very easily understand it's changing and actually make and do something about it. And for example, we recently had a patient that was showing some signs of being pre-diabetic. So even before pre-diabetics, we immediately come up with a plan. The doctor came up with a plan to address that from with a focus, of course, on nutrition, exercise, and very fast we start seeing signs of reversal, right? So this is the kind of thing that we want to do. It's very personalized. It's not one size fits all. Each patient is different, and what we try to do is making sure that we support you to be in charge of your healthcare. And so any signs of like something is changing, we are very fast to address this. Also, because the way we work, where our patients have access to their doctor for whenever they need via phone call, via our app, we also, which allows us to have very short feedback loops. I think traditionally in healthcare, what happens, like we go to the doctor, there's an issue, we come back a few weeks or a few months later to see if there's an improvement, but it's always very like in that moment, in that point of time, we address that concern. There is not a continuity of care as we believe it should be, and so in our approach, in our model, we provide that continuity of care where the patients have access to the doctor anytime that they need. So the feedback loops are actually much shorter, so we can address and adjust the concerns as needed, and the outcomes, of course, are faster and better. I think ultimately what we try to provide patients is, one, convenience, being very easy to interact with, no waiting times, no rushed appointments, and that's a big part of it. And the second part, going back to your question, Steve, is about prevention, right? Making sure that you are in charge of your health, making sure that you know the baseline, you know where you want to go, and you have a doctor that collaboratively with you is able to advise you on where to go. Just one thing that's important to say, because sometimes I do say these kind of things and people say like, but so you only do prevention. And of course, that's not it, right? So a lot of our patients, of course, go through acute situations, of course. And in that case, we help them address that. We only work with family medicine doctors, which can oversee 70 to 80% of your health needs. And then in case when there is a need for something more like where a specialist is required, cardiologists, dermatologists, and so on, we do referrals. So we refer our patient to other specialists that can, and then in certain situations, we can also do coordination of care. So we refer our patients to specialists, and if needed, we are there to support that the coordination of care to make sure, again, that is very convenient for our patients, and that's not a frustration. I think like healthcare or health problems are already very frustrating. I think like the most important thing that we have is our health. If you make healthcare frustrating, I think that's worst that can happen. So that's what we're trying to do, really making sure that our patients don't have that additional frustration, that can focus on getting better, or they can focus on really on the preventive side of things if needed.
Lovely, thank you, Anish. That was really insightful and interesting. Thanks a lot. Obviously, we've got some Q&A, some questions obviously coming through the chat. I don't think we're going to get to all of them. As I said, our teams will come back to you individually if we don't get to your questions at the end of the webinar. And again, I can see that we're getting lots of specific questions around people's own situations. And obviously what we want to do with those ones is sort of take them offline. So again, I think one of my colleagues has put up a link where you can book either a sort of no obligation discovery call with a Portugal Pathways advisor, or in fact, obviously a discovery call with one of the panelists themselves. So again, if there's something specific or personal that you want to talk about, your situation, whether it's health or wealth, please reach out to us and we will get those discovery calls in the diary for you. So Paul Sheedy, I know that obviously you've worked with many an international government in relation to the future of healthcare. So how is innovation going to democratize and reduce the burden on centralized healthcare and change that to sort of an early intervention model, treated at the point of care?
Well, it's a really interesting topic for us, and we research it a lot. The medicine is kind of, medicine grew up out of people eating a leaf off a tree and thinking that helped and stuff. So everybody decides, well, eat the leaf off that tree, and then it doesn't suit some people. And we go on into drug discovery, and doctors look back at some of the treatments that doctors gave in good faith in the past and said, well, you should be put in jail for that, what you did to that patient. even though you thought it was the right thing at the time. And as healthcare has gone on, a lot of drug discovery has been repurposing or just slightly changing drugs, and we've ended up with a system in the West which is really asset heavy, where people end up having to go into hospital, stay in hospital for long-term care, and it's growing at a rate beyond the rate of the cost of it is growing beyond the rate of the development of the economies. So technically it's unaffordable going forward. So something has to give in that going forward, and the end of life care is so expensive compared to the rest. So prevention, what Inês is talking about, just from a personal level, absolutely the right thing to do, but also on a group level, it's a big challenge. But what we see, and I think COVID and the pandemic really gave us a kind of accelerated insight into, we can do a lot of this checking and monitoring and investigation from our home. So we can move from the big hospitals and have to go and sit and wait for 3 hours to be seen for a test that's centralized. We can go from a $2, €2, £2 test being delivered in the post. And you can do screening that way. You can do, like we did with the lateral flow tests, we can do prevention of spread of disease, but we can do a whole lot more with that. And then we can do a whole lot more with the targeted medicines. So, a lot of people won't realize this until they meet somebody who's had it, but a lot of the advanced cancer treatments now are not hospitalized. They're not chemo, they're not radiography. They are tablets, highly specialized chemo, which comes in a tablet. You take it orally, take it twice a day. You don't go to the doctor. You don't go to the hospital. And you can be in an advanced stage of those particular cancers once you're assessed as this being the route for treatment. You can do all of that at home. And that's huge, because even though those tablets are very expensive now because they're the product of a lot of research, pounds and euros and dollars, going forward, the actual chemistry is very cheap. So we can spread, like we did with the AIDS medicine, we spread it around the world for next to nothing, because in the end, it's only chemistry. So that's obviously, as investors, we get very excited about that, because that means there's a whole new frontier of treatment, of diagnosis, of prevention, of treatment that's coming through. And in particular, Paul Stannard mentioned places like the Braga Institute in Portugal for nanotechnology. Nanotechnology is a real hotspot for that, and it's a real area of focus for us. So I think there's two things we can say about health. I think in 20 years, 30 years, 50 years time, they'll look back at things like chemotherapy and they'll say, who did that to people? Who did chemotherapy to people? Because it's such a blunt method. It might be the only method in some cancers, but such a blunt method of treating a disease, and in the future will become highly, highly specialized in that. So that's exciting for all of us. It's exciting for our kids. It's very exciting for our grandchildren, but it's hugely exciting for investors too, because if you can catch the right waves in those areas, there's a lot of returns to be made in the future of healthcare. It's a very exciting opportunity amongst the other ones that Paul talked about. And Portugal is particularly strong in it, which is why we like it.
Yeah, thank you, Paul.
I mean, it's worth mentioning. Sorry, I was just going to say it's worth mentioning that Portugal's had two exits in the biotech space, which it wouldn't have been well famous for 10 years ago, but it's had two exits in the last 12, 18 months, one for 7x, one for 100x. And one of those was an early intervention diagnostic. So 100x. So this early intervention at the point of care, better outcomes in people's homes, how we could ever think putting people in big buildings with lots of ill people was ever going to have a greater outcome. And in reality, I spoke a few years ago at the longevity conference, and I was shocked at a stat. A guy was on before me, and over 50% of the Western world's healthcare is spent on the last 6 weeks of our lives. How can that make any sense whatsoever? So, innovation, point of care, and I think, having things that are going to, change our lives for the good, that don't impact on our lives by catching it early. So diagnostics is going to be a big thing. And in terms of, we've all got used to having Fitbit watches, it'll be nanosensors detecting everything, any kind of change in our physiology or anything in our lives, and can go straight to the GP, like Tejo's, could go straight to the doctor and say, look, there's been a change in you, can you come in, And that's where it's going.
Patients, just to add, we do have a lot of patients that do share their data from Whoop or Fitbit and other health devices. And if you look at it, I think sometimes I have the feeling we know more about our cars, what's happening in the car, that we do about ourselves, right? Right now, we start to see that there's like these dashboards that gather data from several different devices and health monitors. But I think there's an area where we still have a lot to do. And I'm personally very excited with like more diagnosis at home, more treatment at home, and actually we'll be able to actually have a better idea of like where we are in terms of our health, and if there is a slight change, we can do something about it. Let me just add one thing. I do also believe about making healthcare very human. And I think like we need to find a balance there, right? So I feel like we went very much on the transactional side of things, with everything is very automatic. I think that, and with AI, I think we are seeing that even more happening. But at the end of the day, we want the good and the bad news coming from a real human, at least for now. And I believe that we'll want that. I personally want that for the long term, and that the humanity, the empathy of the other side, I think is super important. So finding this balance, we need to know more about our bodies. We need to have a better dashboard of our health, but we need to make sure that the healthcare is still human, and that's what we are trying to do with TejoMed, is really be able to get the medicine 3.0 with the human side, the empathy side of a doctor that is very well trained, but is also very empathetic, and can help you navigate healthcare long term.
Steve, can I just comment on something? Steve, can I just comment on something there? I mean, I think what's being said is amazing, and it's true. And the other thing I think is really worth getting across to our audience is that Portugal is right at the forefront of this. This is way ahead of where other European countries are. They don't have the same legacy problems. They don't have the same issues around staffing so much, particularly in the private sector. And I think, I do feel that we are seeing families move here because they recognise that Portugal gives them the best options to live their best life. And it really does, it's worth reiterating that, you work hard for your wealth. You work hard to make money. In places like Portugal, what it will do is it will help you live longer, live happier, and live healthier.
Absolutely. Thank you, guys. That was a very interesting debate and some great insight into obviously the future of healthcare. Now, just before we get into the Q&A, and again, we've got lots and lots of questions, and we'll try and get through as many as we can. I don't want to sort of keep people sort of too much over the hour. One final sort of question, and Paul Sheedy, I'm going to sort of direct this at you. As obviously you are the sort of special advisor for the Portugal Future Fund, and you guys sort of focus on golden visa residency by investment. What should investors consider when choosing the right investments for sustainable wealth growth in Portugal? And perhaps after Paul, Chris, you can come in behind Paul.
Yeah, so we're the I'm on the investment committee of the Portugal Future Fund, and so we're one what we call as a blended fund. So what we do is we search the opportunities in Portugal and invest in sectors that we like, which Paul actually we would correlate quite closely with Paul's comments there. Healthcare, tech, renewables, tourism, they're all really solid areas of we consider loads of headroom for investment and growth, and loads of great ideas and entrepreneurs. But we're one fund, and I probably shouldn't say this, but I will because it makes for way better relationships with people who invest in us. I wouldn't come to a fund direct, right? If you're interested in what kind of fund you want to do, you should really go to Chris or go to yourselves in Portugal Pathways and start there and get your holistic view of what you're doing, because it depends on what you want from your life as to where you search for in the funds. And I know Portugal Pathways have an index of funds in Portugal, and they can help you sort through what matches your criteria, because if we don't match your criteria, there's no point in being with us, because we're trying to bring you in as an investor when it's not probably the right thing for you to do. Whereas if you come through someone like, if Chris calls us and says, I have a client who wants to talk to you, then we know it fits the strategy that Chris has built up. If you guys call us and say, we'd like you to talk to one of our clients, we know it mirrors the strategy, because people do different things. In Golden Visa or alternative investment funds, because we have the big upside opportunity in what we do, is pretty good, because our funds are 7 years long. So the visa is 5 years long. So it's almost a perfect fit by the time you get in, by the time you get out and make your application. It's a great fit for what you're doing. And you don't need access to your money to it. So you can ride the investment curve until the end and get the exit at the appropriate time and maximize your return. There are other funds for different reasons. There's the ones that track the Portuguese stock market. We don't put any of our funds into that for liquidity reasons. It's just our view. It's not everyone's view, and it's different for different people, to be crystal clear about that. But the Portuguese stock market is small. So when the big ones, have a cold, it gets the flu. If they have a sneeze, it gets a cold. And so it has more exaggerated responses to global impacts and stuff. So we don't like it for liquidity, because when we might want to access it, it might be on one of its downs. And we think it's a limited, but it does suit some people. And again, Chris might tell you, no, you need to have a certain amount of your wealth in that for these reasons. And Portugal Pathways might be presenting one or two of them. So if somebody comes to us and says, what should I be in? First of all, I say, talk to an expert. Talk to an immigration and taxation lawyer. Talk to Portugal Pathways. Talk to wealth managers like Chris. Start there and then work your way down. And they'll give you not just us, but people like us and stuff. We just fancy our chances. If you come to us, we'll fancy on our track record. We'll fancy our chances on convincing you that we're worth the punt for that investment. That's so. And obviously, the health one that always goes to this thing, previous performance is no predictor of future performance, but it's not a bad place to start. And also, I would look at the teams in the fund that you're looking at, or when eventually you get to look at funds. Stability and longevity in the teams that are running the funds are really quite important, because that performance has come from their work. So if you look at what they've done in the past and the team is stable, then it's probably the best place to start to make it some assessment of what you might get in the future.
Thank you. Chris, anything you want to sort of push out on that as well?
Well, I think Paul covered quite a lot there. So there are a few bits, I think he's right. The first place to start is, you want your golden visa, so you have to invest the money into funds that qualify. Well, that's great, but there are lots of them. So you need someone to sit down with you, work through where do your goals sit, where do your values sit, where do your investment timelines sit. Oh, pardon me.
Yes.
Thank you. I think it's important that that's where you start. There are many different types of golden visa funds. I don't think we've ever recommended one that's not a blended golden visa fund, because you're then spreading risk, and we're all about de-risking our clients. I think the other part of it is looking at how they're structured, and the fees and the charges, and how long you're tied in for, and those types of things. If you're talking to the banks, you know what, don't believe that they're independent. Don't believe, they're probably only offering you one structure, one product, and it may not be the right one. It might be the right one, but it may not be. So talk to someone else and work it through. I think, again, I would just highlight, it's like everything in life, take professional advice and value that advice.
Yeah, I would add, note I didn't put the banks down as the list as a place to start.
Yeah.
For that exact reason, the banks are connected to specific funds, and it's just a nice extra bit of cash for them to sell you into.
And guess what? Those funds invest in themselves. So banks are asking you invest often in themselves.
Yeah.
So it's hardly that objective. And I'd back up what Chris was saying about the blended fund approach. There's 3 or 4 types of funds: single sector funds that are in single sectors that are backed by big heavyweight institutions, but the ones across multiple sectors where Portugal is punching above its weight, like some of the ones we discussed earlier, that blended approach of diversification. And I do think Paul did underplay, the track record of the Portugal Future Fund in terms of the fund managers behind it. I think it's your 12th fund, and the team there have delivered consistent returns for decades, and really
modesty
understand.
prevented, Paul. Just modesty prevented.
But it has to be said. But you do need to start by talking to people who are independent, and our Golden Visa Index, we're agnostic, but we're also make sure that you ask all the right questions,
Right. Thanks. Looking at the time, obviously we're approaching the hour. I want to get through a few questions before we wrap up today. Again, rest assured that if we don't get to your particular question, we will obviously reach out to you and get you the answer you're looking for. And again, obviously, just reiterate, if you need or want a call with any of the panelists or with one of Portugal Pathways' own advisors, all on a sort of no obligation basis, please obviously either click on the link or leave your request within the chat. So moving on to the question, and initially I'll come to you first. We've got Amanda, and Amanda is asking, she said, I have a question for Ines. What about when me and my family travel? How are they supported, and what do we need to keep in mind?
Yeah.
So I think
in the context, yeah, exactly. In the context of TaxMed, sorry, Steve, do you want to add something?
Sorry, yeah, I think this obviously is to do specifically with traveling. I'm presuming traveling backwards and forwards from their home countries. I think what Amanda's trying to get to there.
Yeah. So in the context of TaxMed, so when our patients are in Lisbon, in Portugal, they can book in person on online appointments. So again, we try to make it very convenient for our patients. When they are travel though, they also can still connect with their doctor with online appointments via the app. And the good thing, for example, for those that actually are based in Europe or are traveling to Europe, even if they require some kind of like prescription refill, they also can get access to their medications in any EU country. So again, very convenient and very easy. When you are also traveling through the app, you also can have access to the care plans, all the notes from your doctor. So in case there's some kind of emergency, something that you need to see a doctor in the country that you are in, you have that track record. You have your all your like blood tests and other tests that in the app they can be very easily accessed. So again, we try to, for the people that are traveling, and we do have a lot of patients that travel back and forth between Portugal and their country of origin, or sometimes they are very busy professionals with work all around the world. And one of the things that they value is that if there's something that they need, very easily they can reach their doctor. A doctor again that knows them is their doctor, and if they are in the EU and they need a prescription, again, very easy to do. They can get the prescription in their email and then go to a pharmacy and get access to that medication. So we truly value the continuity of care, and it's something that we do with our patients.
Lovely, thank you. I'm going to stay with you. We've got George, and George, he is asking, what are the key factors to consider when choosing private health insurance in Portugal?
Yeah, I think one of the things that we are seeing, at least with the TaxMed members, is that most of our members do have health insurance, right? A lot of them that we have, of course, members that are Portuguese, and we have members that are from all around the world, and they do have health insurance. And for you to have an idea, and this is a stat that I was actually surprised if you when I learned about 40% of the people in Portugal, residents in Portugal, have some kind of like health insurance coverage. So this tells you that clearly this is not something just for a few. This is something that people value, and it again complements the public healthcare system. And people do look for private healthcare, private insurance. Usually, you have to understand, like, again, if the private insurance, what it covers. Usually, it covers consultations, like procedures, tests, or hospitalizations. So I think again, insurance is good for us to have in case of things go wrong. I think that's an important part of things. Something for you to consider. And I read somewhere in the chat that someone was looking at that, is like preconditions. So some health insurance, if you have like preconditions, some health insurance might penalize you because of that. That's the truth and how it works. Others, that's different. Others don't. So I think what I would definitely recommend is to talk with a insurance broker, someone that can offer you a few options that really that are able to address your needs. Just be careful with the coverage. Be careful with in terms of like the preconditions. I think that's a very important one. And finally, something that I think is also important to consider is like sometimes the top doctors in Lisbon, or in Portugal, like some of the most well-known ones, if they have like a private office, they usually don't take insurance. Some of them might take, but a lot of them don't. So also, like, if there is a specific doctor a doctor that you want to go to, understand if they offer, if they take health insurance, what kind of health insurance, what is the coverage. I think that's something that for you to consider.
Thank you, Inish. Question from Ahmed, and I'm going to go to Paul Sheedy and Chris on this one. And Ahmed is asking, what are the safest long-term investment options in Portugal right now?
So when you ask for the safest long-term investment, when I'm finished, I'll pass the crystal ball to Chris, and then he can have a look in then and tell you the same thing. Look, safety in investment comes from diversification. So you avoid specific risk by putting all your eggs in one basket. I'm sure I'm telling a lot of people how to suck eggs. So that's the first thing, that you have to diversify away from what for specific risk. And then systemic risk is usually about time and stuff. So if there's a big shock to the system and everything gets a bit of a wallop and has to come back over a couple of years, then that's the class of investment asset you have, whether you keep something in bonds and stuff. And Chris is far more qualified than me to talk about that stuff. But in terms of the long-term safest, best, I can tell you what we think is the long-term best investments. They're in the sectors we talked about. We like healthcare, for all what you've heard on today. We like technology, particularly healthcare technology. Again, we like renewables. We like high level tourism. We everywhere that Paul Standard did so well in the in laying out in from his perspective in the slides is pretty much where we're excited as well. We love the advanced technologies in the startup. We think that's truly change the world kind of stuff, disruptive technology. So we like to throw in a bit of them. But if you want safe and stuff, Chris, go on. The great sage that you tell them how to make sure that everything is safe forever.
That's it. I'll pick that one up and see what I can do with it. If you want safe, you know what you need to do. I mean, the safest place is cash in the bank, because that won't go down, but then you might lose money compared to inflation. There are so many definitions of the word safe. It's all about your timescales. It's all about your individual needs. In some ways, if you're looking for a really safe investment, you're probably not of the mindset to be investing into markets and into funds and into things. You need a 5 to 7 year time horizon, I would say, if you're looking to do things like that. We all saw what happened in the last week, over in America. Nobody in their wildest dreams expected tariffs on China to be up at 140%. Now, even what he said on his campaign trail. So, everything's taken a shift. All I can say to you is that if you sit down with any good quality wealth manager or tax structurer or anybody that sits and talks to you about what they can offer you, 100% safe probably doesn't even exist in the market if you wanted to go down that road. Everything carries just a slight bit of risk. It's then about how much risk can you take and what do you want to do. The only way you can do it, Paul's right, it's diversification, both by asset class, by time scale, by country, by continent, and it's building up something that stands the test of time. But to answer that question, Steve, I could sit and talk for another hour and still not give you an answer, because
we haven't really got an hour. We actually gone over the hour, so I'm going to have one more question before I ask you guys just to give everyone your sort of takeaway. Chris, I'm going to stay with you on this one. This is a question from Leonard. And Leonard is an expat in Portugal, originally from the UK, and he is coming to the end of his NHR tax sort of status. And he's asking, what are the most tax efficient ways to manage his wealth, as he only has 4 years left of the NHR tax benefit?
Okay. I'd love to have spoken to Leonard 4 years ago, but we can only speak to people when they come on the calls. Early planning is essential when you move to Portugal. When we bring families over, what we do is, we sit them down, we talk to them about how they need to structure themselves, both in their country of origin and moving to Portugal. There are various tax structures out here that give you amazing tax benefits. They work on the basis that the longer you hold them, the better the benefits are. So that's why I said, if he'd been here 4 years ago, we would now be able to get him into some really significantly low tax rates. At the moment, they're NHR ends, but equally, you'll still get some significant benefits. The tax rate will reduce from 28 to 18 and then down to 11, and it's only on the growth of the structure. But let's talk about what should we be doing. Probably the thing to be doing is looking to turn your retirement savings on its head, because you can access your pensions in the UK. So if they've had it, 6 years, so they may even well be able to access them at 0%. Maybe they get their pensions out without paying any tax. Now, we all know that in 2027, I say we all know, that's terrible. In 2027, inheritance tax is going to start being applied to UK pension pots. So that's 40%. That's a 40% tax on top of the income tax that you'll pay to take it out. So people will be paying 65, 70% tax rates on money out of a pension. So what we need to do is to get that out of the UK as quickly as possible. So we would draw that down, and we'd need to look at other assets and what they do with it, things like ISAs, because actually, once you get to the end of your NHR and you've been outside the UK for 10 years, you know what? As from the 6th of April this year, you're no longer liable to UK inheritance tax. So you save 40% on everything you've saved. So you save 40% on any house that you've got in Portugal. You save 40% on any assets you hold in Portugal. You'll still pay 40% if you've got a house in the UK, if you've got assets in the UK. So we need to sit down with you, look at the best way to bring those assets out, structure them into something that gives Leonard the flexibility and choice he wants with the investment risk he wants. It's a process that, as I say, with our families, we start right at the beginning, right at the very beginning when people move. But it's never too early to start planning. So most people come here, enjoy themselves for 3 or 4 years, and then think, okay, what happens when NHR ends? I think from our point of view, go and take some advice. Go and talk, contact Portugal Pathways, get in touch with their wealth management people, because there is so much that can be done in the next 4 years. You'll be amazed at how much you can save. And procrastination is the killer, because that will be the one that stops you, and it ends up costing you so much money.
Brilliant. Thank you, Chris. So I'm going to draw a line under the questions. Quite obviously, we didn't get to all of the questions today. Our team will be working behind the scenes to go back to you all individually, to those that we didn't get to. I want to obviously thank you, the audience, initially for taking the time to be with us today. Hopefully you found it insightful and interesting. If there's anything that you want to learn more about that applies to your specific situation, please reach out to us and we'll organise, as I said, either a call with one of our experts or a sort of no obligation discovery call with one of our teams. But before we go, I want to go around the room with our panelists and really just get that sort of one sort of key takeaway that they feel that the audience should sort of take on board today. So Paul Sheedy, I'm just going to start with you on that.
I'll be short. Your health is your wealth, but look after both. And I would strongly advise, if you're thinking about funds like ours, the Portugal Future Fund, to start with a professional. And there's two organisations on the call which aren't a bad place to start, but there are others. And if we're right for you, then we look forward to talking to you at some point down the road when you've had those discussions. Best of luck and thanks for everyone for joining.
Thank you, Paul. Chris?
I think the takeaway from this call is do your research. Talk to Portugal Pathways, talk to Inish's company. Do what you need to do, because health and wealth are important. Health is vital, but you need to understand what you're getting into when you move. When we concierge for our clients, so we hold their hand on everything they do all the way through the process. And I know, when we've engaged them with Portugal Pathways, there are lots of areas where they can help in, whether it be the visa side of things, whether it be the health side of things. But do your research and work with quality advisors that you trust.
Thank you, Paul. Thank you, Chris. Inish, over to you.
I think as was said here, Portugal offers a lot of high quality lifestyle. It's a great country for you to live in. It has a good healthcare system. Healthcare doesn't need to be a frustration. So make sure that, as Chris was saying, you do your research, you find things that work for you. And if it makes sense for you to talk to us, we are here. We are here to support you. And just make sure that you live your best life in Portugal, because I do believe that Portugal has a lot to offer.
Lovely, thank you, Inish. And lastly, Paul.
Well, I'm going to sort of back up the last comment. Portugal's good for your health, and diversification. Having a support from the private sector as well as the public sector. It works in Portugal, and I'd embrace it, and I'd do the same with your investment. Diversification is the key to happiness, and I think Portugal can sprinkle some magic dust on all of that.
Brilliant. Thank you, Paul. And thank you to all of our panelists today. It's been a really engaging, insightful session. Again, obviously, we'll be sending out the recording to everybody so that they can obviously absorb some of that detail in their own time. Our next webinar is Top Sectors for Investment in Portugal, and that's on April the 29th at 4 p.m. There is a link on the screen now, really just to sort of book that. But again, we'll be contacting everybody and letting them know that particular webinar. So just leave it to say a big thank you to everybody, the audience, the panelists. Until next time, we wish you good health and lots of wealth. Thank you.
Thanks, everyone.